Next up, we have Joseph Kim from NYU, and he will be talking about screening for vaccination status and providing appropriate COVID-19 vaccine education to radiation oncology patients.
Hear me? All right, great. Hi, everyone. Thank you for coming to and joining for the talk. My name is Joseph Kim, and this is a quality improvement and patient safety center project that I initiated at NYU, which is a part of our department. The motivation behind starting this project was, trying to improve the outcomes for patients and to prevent any delays in care and improve vaccination rates within our department for our patients with cancer. So in terms of the background purpose, just in terms of context, I started my training as a resident during the peak of COVID. I did my intern year in New York during when COVID first broke out and worked in the ICU. So I was able to witness a lot of the damage that COVID did to our patients. And then started my residency training at NYU. During my first year of training, I noticed that several patients were not vaccinated or were hesitant to get vaccinated. And a lot of the reasons varied. Some patients just thought, I'm going to get sick anyways, so I don't need the vaccine. Others had reasons such as, I only want to deal with one thing at a time. Cancer is enough right now, I can't focus on anything else. And other patients had a mistrust of the system or the healthcare system. A particular patient who identified as a Black female, and she said she didn't trust, the healthcare system. And after talking to her and sitting down with her, addressing her concerns, she eventually went on to get vaccinated. So I think I saw that there was a potential, and I brought this up to our department, and they were, I was lucky enough to get support to start an initiative. There's been several delays or suboptimal delivery of RT that can compromise local control and survival in cancer patients. During the pandemic, various solutions have been developed to optimize radiation therapy, including using shorter radiation treatment plans or giving some form of systemic or hormonal therapy first until they can be safe enough to get radiation. Adoption of PPE and for both patients and staff and safety protocols. Furthermore, radiation interruptions can lead to needing additional fractions or altering the dosage or replanning treatments to compensate for the changes in their treatments. So the goal was to use and leverage this patient-provider relationship to identify reasons that patients have to forego vaccination, address their concerns, and then to encourage COVID-19 vaccination for patients with cancer. So we identified patients from November of 2021 to February of 2022 who had either unvaccinated or undocumented COVID-19 vaccine status. Instruction was provided to our healthcare practitioners on how to reconcile this information within our EPIC system. And then we also distributed weekly reports of unvaccinated patients for upcoming consults to all attending physicians and healthcare providers, so that they would know who would be eligible to receive education. Patients were also, given things such as vaccine resources or directions to other, national resources for regarding the COVID-19 virus and vaccination. Patients were also, throughout the process, we had various changes in our policy, but most of the, time during this time period, we would have patients undergo pre-simulation PCR testing to make sure that they were negative before going on to get treatments. So in terms of results, we did have a relatively low level of vaccine education that was delivered to patients, and we can go through the various reasons why. When the project first initially started, we see that it started very low. This is probably just kind of rolling out with the project and having people aware. So we had 909 patient consults during this time. 152 patients were unvaccinated or undocumented, and then of these, 147 were eligible for vaccine education. A few of these were excluded. One was declined prior, 3 were pediatrics, and 1 had a patient with dementia. 27 patients, so 20% of them, received vaccine education, and then only 6 of those patients initiated COVID-19 vaccination within 60 days of consult. In terms of the PCR testing, we did test most of our patients, and we see that the testing did go up during the Omicron spike, and 32 patients ended up testing positive during this time period. We can look at our overall vaccination rates compared to New York City. We see that the overall vaccination rate for our radiation oncology patients at NYU was quite high compared to New York City, in the around 80%. So in conclusion, the COVID-19 pandemic has significant effects on diagnosis, management, and outcomes of oncology patients. We did develop an education program to identify patients who are unvaccinated and to improve the rates of vaccination by addressing their specific concerns and providing them with accurate information. We had 18.4% of patients who were eligible for vaccination, who received vaccine education, and then about 6 of those patients received partial full vaccination. So overall, we did, my goal when I started this project was that even if I had one patient receive the vaccine from receiving some information from us, it would be successful. We had 6. I think overall there's a lot of challenges. Obviously, clinics can be busy. We see an overall very low rate of patients who are eligible receiving education. So I think those challenges are there. And then, the only things I wish I could have changed is starting this project earlier, and perhaps really pushing for more of our staff to deliver the education to eligible patients. These are some of the people who are involved. So the department-wide contribution and efforts. So I want to thank all of them, and thank you guys for listening.